So we'll be answering the exam question, therapeutic applications of eicosanoids. That's basically you looking at the clinical uses of eicosanoids, okay? And we say that eicosanoids are basically like potent chemical messengers that have well-established role in regulation of what? Inflammation, immunity, and platelet aggregation, okay, amongst others, okay? So we'll be looking at how we can use these eicosanoids, right, to basically improve many medical conditions, right? That's what we'll be looking at. Suitable examples discuss the therapeutic applications of what eicosanoids, right? And that's what we're going through. So these are examples of eicosanoids. Prostaglandin, which actually what mediates inflammation and pain. Prostacyclin mediates what vasodilation and what gastroprotection. Then thromboxane mediates what platelet aggregation. Then leukotrienes mediates what inflammation and chemotaxis and what bronchoconstriction. Right. So we'll be looking at the applications of this eicosanoid. Moving now, we said that therapeutic applications of eicosanoids. First, they can be of use in the what gynecological what obstetric use. That's let's say for example prostaglandin 2 or the PGF alpha and their analogs. They are effective for abortifacient. Okay, that means they can be used for what abortion. Right? If there's a pregnancy that you don't really need, okay, or maybe basically if there's a pregnancy you don't really need, all right, I want to actually do some abortion, okay, these prostaglandins and the PGF alpha and their analogs, they are effective for this, okay. So examples of these analogs, we have dinoprost and so dinoprost, a bar of what prostaglandin F2 alpha, okay, that's the full name, prostaglandin F2 alpha. It is used to induce second trimester abortion and is administered as a single 440 milligram dose, okay, intra-amniotic injection. So you apply it directly into the amniotic sac. Do you understand? This is dinoprost. Then for the carboprost, we said that it's a sort of what? 15 methyl prostaglandin F2 alpha 2, all right, and is given repeatedly intramuscularly to induce abortion, okay. Up to total dose of 2.6 milligram is required, okay. It is also used in prevention of postpartum hemorrhage, okay. So after you are giving birth, if there's a tendency of you bleeding too much, then they can give this carboprost, okay. So it can induce abortion and it can be used to what stop that excessive bleeding after giving birth, okay. So talking about prostaglandins, right? Now let's move to the next. And also it can be used for the facilitation, there is a T here, facilitation of labor, okay. Basically when the infant is at the embryo state, it can be used for what abortion. But when the pregnancy is close to delivery, it can be used to what facilitate labor. Basically, these drugs act what for expulsion of fetus. Do you understand? So the prostaglandin E2, especially misoprostol and the prostaglandin F2 alpha and their analogs, they can initiate and stimulate laboral term. Okay, and this is what under the gynecological obstetric use, they can be used for abortion or facilitate labor. So moving to their applications in the gastrointestinal tract now, we say that misoprostol and emprostrol, they are analogs of what? Prostaglandin E2 and prostaglandin E1, okay? And they can act on the EP2 receptors, causing inhibition of acid secretion and increased mucus secretion, okay. So any condition that causes excessive gastric acid secretion in the body will make you what susceptible to ulcers, okay. So if these drugs can inhibit this acid secretion, then they can be able to use the what cure ulcer. Do you understand? So they are used for the prevention of gastric ulcers during long-term therapy with what? Non-steroidal anti-inflammatory drugs. Okay, so if you are treating a patient with non-steroidal anti-inflammatory drugs, their side effect is ulcer. Okay, so as you are treating with non-steroidal anti-inflammatory drugs, you are using this analogs of prostaglandin E2 and prostaglandin E1 to actually prevent this likely um, ulcer that is supposed to come up. All right, so these are the examples of eicosanoids. I'll be putting up more of their clinical applications in the description of this video. So what I'm actually trying to do now is I make videos just short for students that don't really like stress. Then in the description of this video, I actually put in the details, right? So when you watch, you read. That's why I want to actually turn this channel to. All right. So next example, also Atrotex, which is a combination of diclofenac and misoprostol, is used for this purpose. Now, which purpose are we talking about? The prevention of gastric ulcers. Okay. Then a dosage of what misoprostol, that's 200 micrograms 4 times a day. All right. The drug is contraindicated in pregnant women. We're still talking about this. All right, this Atrotex. All right, dosage of misoprostol, because this misoprostol will now be combined with diclofenac, all right, and can be used to prevent gastric ulcers. So let's look at the effect of these drugs on the cardiovascular system. We said that both prostaglandin E2 and prostaglandin E1 and prostaglandin I2, they are used for improving the harvest and storage of blood platelets for therapeutic transfusion. So if you need a transplant of just platelets, so these drugs can be used to actually preserve platelets, okay, during the harvest and also the transfusion, okay. And they are also used to maintain potency of ductus arteriosus. That's in maybe infants that have possibility of the ductus arteriosus collapsing. Right, this drug can be used to actually maintain the potency. Then prostaglandin E1 and prostaglandin I2, they are used to induce pulmonary blood flow and oxygenation of blood in neonates with congenital heart defect. Okay, prior to surgical correction of the congenital defect. Right. So if a neonate has a congenital heart defect and you have corrected it surgically, then you can use it to induce pulmonary blood flow, basically improve the flow of blood in the heart. Okay. And for the ophthalmic use, that's the use on the eye, I would say that latanoprost eye drug is used in the management of open angle glaucoma. Okay. Therefore, erectile dysfunction, we said that drugs like aprostadil is injected into the penis and is effective in the treatment of male impotency. All right. So these drugs, aprostadil, can be used to correct male impotency. Okay. So these are the various applications of therapeutic applications of eicosanoids. All right. Basically, how they are used clinically. All right. So that's it, and bye for now.